I've been here just since 1.5 weeks. I'm originally Lebanese, but I grew up in Germany, where I also studied medicine, and I did my formation in France, Lebanon, and in Germany. Before I was here, they were very limited in the number and in the type of surgeries they were able to do. And now they have we cover a much wider range. And of course, we are 3 people to do this immense work, which is at the Kabwaii Eye Unit, which makes up to 80% of the surgeries of the country. Imagine for 12 million people. Or without the support of the CBM contributors, it would definitely not be possible for me neither to be here, neither for the clinic to have been in such an advanced stage. First of all, it's not only about the financial support they give, it's also about the team that comes and visits, that comes and motivates. It's about the medical advisors which are in the background, which help us with advanced or with newer technology. It's also about all the lobby work that's been done by CBM and its co-workers to strengthen the public health systems of those countries, which is very important. So finally to treat a patient, there are many different things which come together, and definitely in Rwanda it would have not been that developed without the support of CBM. But the problem is not just here. The problem is that patients are presenting very late, and that there is a very little capacity in this country to take over the ophthalmic treatment for 12 million patients. So I say that there is still a lot which needs to be done in Rwanda to improve the eye health care and to prevent blindness. And especially the prevention or the early presentation is what's important. And that's why to make to distribute the eye health care over several areas in the country is an absolute must. But I think that the biggest problem, and also speaking with people, the biggest problem is the transport coming to the hospital. Because despite that Rwanda is a very small country, transport is much more difficult here than in Europe. And distances cannot be overcome in such a quick way like back home. And also, if you put yourself into the situation of the people, they maybe have a couple of euros and they have to decide either they spend it for having dinner or they spend it to drive to the hospital. And especially when you have children at home and you have a big family, and what you're taking from the family to come to the hospital will have a direct effect on maybe their children going hungry to bed. You may decide of not coming to the hospital, but staying blind. So it is very important that we distribute the services across the country. We reduce the distance between the services, the ophthalmic services, and the patients. And this can only be done by distributing ophthalmic services across the country. So it's great news that the UK government is doubling the donations given by people, and thus helping to deliver the services that are needed, and especially to distribute the services across the country.